Dr. Eric Walsh joins us live now from Hartford Healthcare. He's the medical director of Hartford Healthcare Go Health Urgent Care. And thank you so much for being with us, Dr. Walsh. I appreciate it.
Thank you for having me.
Of course. So first off, are you seeing more patients because of these heat-related illnesses?
Yeah, we are seeing an uptick in heat cramps and even some cases of heat exhaustion. So we are seeing that some folk are, having some trouble adjusting to the heat.
What are the difference between those two? What are the symptoms? What should people be on the lookout for?
So heat cramp is the mildest version of a heat illness. It's usually what happens when your body can't keep up with the loss of electrolytes from sweat. So your skin is actually flushed, it's moist, but the muscles begin to spasm and cramp because important electrolytes like sodium and potassium are leaving your body faster than you can replace them. It can be resolved pretty easily by hydration, especially with sports drinks, and moving to a cool place. And within 30 minutes, people will start to feel better. Heat exhaustion is a little more serious. And at that point, nausea, vomiting can kick in. Obviously, you still have the cramps, but this just means that you're losing fluid and electrolytes faster than you can replace them, and you get into a pretty serious deficit.
Does it affect kids or adults, or is everybody susceptible to this?
Everyone is susceptible to it. Obviously, the younger you are and the older you are, the more susceptible you are. There's certain medications, if you're taking them, like diuretics, that can actually make the situation much more easier for you to fall prey to heat exhaustion as well.
And typically, how long does it take folks to recover? Is it a long recovery process, just a few hours? What do you usually see?
So it depends on how bad it gets. I mean, obviously, if someone is out playing, serious full-court basketball in this heat for an hour and a half, it starts to really feel bad and not drinking enough. It might take them, an hour to recover if they hydrate and they're just having cramps. In about 30 minutes, heat exhaustion or heat cramps, if you reverse the heat setting and hydrate, will both begin to get better. So between 30 minutes and an hour. Now, heat stroke, the most serious version of this, means you have to go into a hospital, get intravenous fluids, and that you might be in the hospital a little while recovering from that.
All right, Dr. Walsh, thank you so much from Hartford Healthcare. I appreciate it.
Thank you for having me again.